Good afternoon, everyone. I'm Dr. Adam London from the Kent County Health Department, and I'd like to welcome everyone here. We understand there's a lot of confusion, there's a lot of fear in the community about what's happening with COVID-19. We would like to have a situational update this afternoon, and we will be prepared to give you more updates as this developing situation unfolds in front of us. I think it's really important that we're sharing information in a very transparent way with our community as we address this emerging issue. I'm also joined today by Christina Wayman from the Ottawa County Department of Public Health. Christina is here representing Lisa Stefanovsky, who is the health officer in Ottawa County, and she's going to have a statement at the end of mine. So a brief situational update. What has changed? Well, today we learned that Governor Whitmer has signed an executive order which importantly prohibits mass gatherings of 250 people or more. That's very important to us and gives all of us statewide very objective clarity in what's expected and what needs to happen with mass gatherings. The recommendation for the cancellation or postponement of mass gatherings between 100 and 249 people still stands. So we're holding on to this recommendation that we should not be gathering at 100 people or more, and at 250 people or more is actually prohibited by state law through that executive order. The governor also clarified the stance on daycares. It was a little unclear last night what was going to happen with daycares attached to schools. It's now clear that daycares attached to a school building can remain open. We've learned this afternoon that there are 4 additional cases that have been diagnosed by the state laboratory of COVID-19 in the state of Michigan. Those 4 cases are not in Kent County. I can't say at this time because I don't know exactly where they are located, but they're not in Kent County. Of course, more sampling is happening all the time, more testing is happening on an ongoing basis, so stay tuned for more information. We have a reminder that this is a very fluid situation, and as these details change and the number of cases changes, we're going to provide that information to you. What we might share at 10 o'clock in the morning might change dramatically by the time we're talking to you again at the end of the day. That's not because we're trying to mislead anyone. It's not because we're trying to hide any information or be deceptive with anyone. We're truly trying to be transparent in as real-time of approach as possible. So I would just ask for the community's patience and understanding with us as we do that. I also want to stress, and this is very important thing that I'm going to say today, is that we need to be very mindful of protecting our healthcare facilities. Right now, our hospitals and our doctors' offices are absolutely being overwhelmed by people who are concerned that they have COVID-19. We need to make sure that we're first calling our doctor's office, calling the emergency room, and not just showing up and expecting a test. That's not helpful. It's exhausting a very limited supply of testing resources, and it's also putting our healthcare workers in danger of being exposed to COVID-19, but also, just as importantly, to influenza and the common cold. Again, if you're experiencing symptoms that you think might be consistent with COVID-19, please call. Call your doctor's office, call the emergency department first. We've had some questions regarding the cases that we notified you about last night, and we understand that right now these people are the face of this pandemic here in our community. However, that's a face that we don't want you to see. To be very mindful of their confidentiality. It's very important that we protect them. It's also important to realize that exposing their name, exposing their address, exposing further details about their case or their current condition is not helpful in a public health and only exposes them or their community to stigma that's not helpful. We have also some offers of assistance from the community and community partners. And I just want to say that we have an amazing team here in Kent County and throughout West Michigan. We've got some folks who have been putting in a lot of hours, long hours into the night and early in the morning. And I don't think that many of us have got much sleep, and I don't expect that we're going to get much sleep anytime soon. I want you to know that we have a team of people who are from this community, who love this community, who live in this community, and we care very much about you. We care very much about our team. And we're hearing a lot of support from the community. I want to thank those of you who have given us support, either on social media or in any other form. We appreciate that very much. The response has been very generous. We simply can't respond to everyone, and we can't respond to all of these offers of support at this time. Please know, however, that we are keeping track of those offers for support, and we may well be relying on you, and you know who you are, in the community for help as the need develops. But there is one need that I do want to share with the community, and that is that we're hearing that because people are concerned about going out and going into places where other people gather, we're starting to see a shortage in our blood supply here in our blood banks in West Michigan. And that's not because COVID-19 is causing people to lose blood. It's because people are they're thinking about how do they prepare themselves for 14 days perhaps of quarantine. Well, I want you to also think about how can we prepare our community. And one way that we can do that is making sure that our blood banks are properly supplied. And so one way you can do that is by signing up for a blood drive that we are hosting on Monday, March 16th from 8 in the morning until 2 p.m. If you want to learn how to register for that blood drive, please visit the Kent County Health Department Facebook page. And I, again, appreciate the support of the community. I appreciate your patience. And please look forward to more updates from me as the situation unfolds. And now I'd like to introduce Christina Waymink from the Ottawa County Department of Public Health. Thank you. Christina.
Thank you, Dr. London. Thank you for coming out today. I'm here representing Ottawa County with the Ottawa County Department of Public Health. And I understand this is a trying time. There's a lot of uncertainty, a lot of questions, a lot of heightened anxiety, and we just want you to know that public health officials at every level, local, state, federal, are working together diligently because we want to ensure our communities are safe and healthy. As Dr. London said, we are working tirelessly around the clock. We have to be reminded by our staff to sleep and eat. But we have you at the forefront of our mind, making sure that we get life back to normal as quickly as possible, because I know with all the cancellations, people's schedules having to rearrange, there's a lot of frustration, so we get that. We are working very hard with our local, state, and federal partners, and in our communities, we are working closely with our schools, the businesses, places that hold large-scale events, places of worship, and so many other organizations, hospitals, long-term care facilities. So we are covering the basis, so we are extremely thankful that you are patient with us as we work through this. And as we mentioned, the situation is continually changing, and we will keep the public updated as we receive more information. Just to confirm, Ottawa County does not have any positive cases at this time. To stay up to date with what's happening in Ottawa County, you can go to miottawa.org/MIHealth. We will update the testing numbers daily, and any other information that we have to submit will be also posted on that website. Thank you.
Thank you, Christina. And I also want to encourage everyone to get our updates in real time. Please go to accesskent.com. We have updates posted there, and please like and follow our Facebook page as well. And at this time, we can take questions.
Testing is really the big issue here, right? I mean, are we reaching a point where we're seeing adequate testing? How far are we from that? And kind of what's the status of testing?
Yeah, so testing is, as you mentioned, it's very inadequate right now. There just are not currently enough test kits to handle the volume of people that want to be tested, that even the volume of people that really should be tested. Now, we just heard from the President in his address that hopefully there are some more innovative ways to get testing done using a variety of private partners and a new test. So we're very hopeful that that's going to come to fruition, but right now, you're absolutely right. There simply are not enough test kits. And to further underscore that, we're hearing from our hospitals that they are running very, very low in their supply of testing supplies, and we're all, throughout this response, running low on the medical safety supplies. So again, if you're not sick enough where it's an urgent situation that you need to go to the emergency room, please don't go to the emergency room without first contacting your doctor or contacting that emergency department.
Approximately how many tests have been done in Kent County? How many tests approximately have been done in Ottawa County?
I can't give you that number right now. Ottawa County, Dr. Bora, do you have an approximate number how many we have done? Sorry, this is unconventional, but this is absolutely our commitment trying to get you accurate information. Christina, do you know in Ottawa County approximately how many tests have been submitted?
We just updated it this morning. If you could go to our website to double check. I believe it's been 20 sent in, but keep in mind that is with the Michigan Bureau of Labs. That does not include any commercial testing. These are tests that were sent in directly to the state lab. We are trying to get aggregate information. That process is still happening, so any new information we will post on our website.
But you're saying the approximate number in Ottawa County right now is 20?
That had tests on it, yes. Yep. But if you could confirm that number on our website. And then we also have on there the number that came back negative, and with 0 positive, so the rest are still pending.
What about the possibility of allowing testing to be done at local hospitals? Have we heard any further from state Health Human Services Department if that process is going to move along any quicker?
Yeah, so we've been contacting all of our healthcare partners over the course of the past several days, talking about the potential for doing some non-conventional approaches to collecting specimens and doing testing, such as car-side or drive-through testing clinics. We are planning, the county is also looking at plans to offer that sort of care. We've also heard just now from the President that maybe some private or corporations like Walmart, Walgreens, CVS, Target are also looking at ways they can get into that. So we're hoping that that comes to be. The challenge right now that we still have are the testing kits, the reagents, and the medical safety supplies. Dr. Ward, do you have a number for the number of tests that we have? I can't see that far, guys.
45 specimens submitted, 14 negative, 3 positive, and 28
So
pending.
45 have been submitted from Kent County. 14 have been negative thus far. 3 positive.
28 are pending.
And 28 are currently pending at the state laboratory.
Do you know obviously the testing is very limited right now. Do you know, with the limited resources you have right now, how many tests are you able to do on a daily basis?
So we have not been given a number or an allocation from our healthcare partners or from the state laboratory, but we do know that right now the pinch point is the test kits, but it's also the collection kits that are used for collecting those nasal swabs. So all of the supportive supplies are running very low. And that's why it's, again, very important that if people aren't seriously sick and they don't really need to go to the hospital because they need urgent care, it's really important that we're using those limited supplies as wisely as possible.
We've seen in other countries, Italy specifically, where hospitals have just become swamped, overwhelmed, unable to do their basic work. What's being done here to prevent that same situation?
Yeah, so our hospitals, they do a tremendous job, and they've seen this coming for a while. They all have contingency plans. They are all bringing in all of the resources that they have in order to make sure they can provide care to their patients and to the community as needed. I think they're all addressing it in their own ways. because they all have a little bit different architecture of how they provide service and who they provide service to. But rest assured, they are very concerned about that. They're already very burdened, especially in the emergency departments, but they are looking at alternative ways to enhance their ability to serve.
You mentioned that the problem is the doctor's offices and health centers are being overrun. I know your recommendation was people can call, or you should call first. Do you know, are there other methods people can do? Is there an online option you're recommending people do, or is your recommendation just to call and not go there?
So there are telehealth options available through some of them. I'm not going to specifically mention them here because I want to make sure that the healthcare systems are providing that guidance, so you have the most accurate information at the moment. But yes, they are being very mindful to provide alternative ways that you can interact with physicians besides physically going to the hospital. And in most cases with this, there's very little analysis that can't be done through a virtual or remote type of encounter.
And again, we are on daily conference calls with the Michigan Department of Health and Human Services to try to expand solutions for this. We understand that testing is a concern. Just for you, so you know, the Ottawa County Department of Public Health does not have offering testing to the public. So at this time, we are advising people go to their healthcare provider, although I know that system is getting very burdened. But again, we are in daily conversations with the state to be able to help address some of these issues.
People want to do things to help. People want to help their neighbors.
Sure.
I mean, what are the realistic things that people can do to kind of help out this situation?
You know, so I think the most important thing that I would encourage people are those who are the most vulnerable. And we have seen pretty obviously through the data that vulnerable population is the older population. It's also those who have underlying health conditions, especially lung disease, heart disease, diabetes. And so I would ask the community to please be mindful of those people in their family, those people in their neighborhood. Make sure that we're checking up on them and make sure that we're enabling them to get the things they need with going out into the community unnecessarily themselves. So if you can pick up groceries for a neighbor, if you can run other errands for someone who is in those high-risk categories, this is the time neighbor who could use the protection at this time. But also encourage people to be mindful of those who are in our long-term care centers and adult foster care homes and places where we have gatherings of vulnerable people in residency, and make sure that we're not infection into those centers. So if you are sick, and this is important, if you are sick, especially with cough and fever, stay home. Don't go and visit those who are most vulnerable. And for that matter, don't go to work, don't go to school. We have to do what we can at this moment to isolate illness. And COVID-19, yes, of course, but also influenza. As I mentioned, our healthcare facilities are being overwhelmed right now with people who are concerned about COVID-19. Very few, very, very few of those tests, and there are them being conducted, but very few of the screenings of people who have respiratory type illness come back positive for COVID-19. We've had 3 so far, as you know, in Kent County, but a huge number of that group have influenza, and that's what they're finding when they go to the hospital. So let's keep the influenza away from our neighbors as well.
It's not too late to get your flu shot.
Yeah, thank you, Christine. That's the flu shot. So great point. Let's get our flu shot so we can, again, reduce the influenza. It's about 2 weeks for the flu shot to really stimulate the immune response in your body. As you know, the increase in is only likely to increase and spike over the next few weeks. Let's not waste any more time. Please go out there and get your flu shot. Let's do what we can to increase our immunity to that. At least we'll have that protection going for us.
They put out a list of the different places that these people who tested positive, the Jimmy John's and Subway.
Oakland County case that had a history of dining in Kent County. You know, there is nothing to be concerned about for people dining in those locations now. The virus itself does not persist in the environment for than a couple hours at the most. There is very low risk to anyone who might have been dining in the restaurant at the same time that person was there. So, you know, if you were at restaurants and you think you have consistent with COVID-19, you'd want to mention that when you call your doctor's office as a possible exposure to risk. But in reality, the risk of actually contracting infection because of dining at one of those restaurants at that time is very low.
Do we expect to see any other cases of infection of people that work in those locations because they were around those points?
Yeah, it's a very low probability that they would get infection because of their time there. I think, you know, overall, all of us are at some level of risk now just because the virus is here. And I think it's important that we all recognize that these prohibitions against mass gatherings and recommendations against mass gatherings are important because for every person who is sick enough to be hospitalized or tested, there are probably many others who are either asymptomatic or just mildly symptomatic. And so we are, many of us are probably being exposed on some regularity, and it's important that we do what we can to protect ourselves and minimize that.
When you say that doctor's offices, CRs, hospitals are being overrun by people who want to get tested for COVID-19, are you finding that a good amount of people who are wanting to get tested aren't showing any symptoms at all? And is your recommendation, like other health officials say, that you only should do or ask about testing if you're actually showing symptoms?
Yes, yes, and we are hearing many situations where people who have symptoms that are not consistent at all with COVID-19 are really putting pressure on physicians to get tested. And that's just not an appropriate use of our very limited supplies.
And just so people know, when doctor's offices and ERs get overrun, can you talk about some of the effects this can have?
Yeah, that's a great question. And so, you know, their time is also limited. And so when they are triaging these situations which are maybe asymptomatic, the worried well, so to speak, that is just adding to the burden. And that compromises their ability to care for the other crises in our community. So, you know, the world's not stopping for COVID-19, despite the fact that a lot of our venues and events are closing down. The reality is we're still having all kinds of other medical emergencies as well. We need to make sure that we're empowering our healthcare providers with the time and the space to care for the emergencies.
Speak to the Oakland County situation. You're not, the three people in Kent County, I don't know, on their way back to Kent County from the airport, if they stop places, you're not giving that out, is that correct?
Not at this time. Well, you know, we're still in the middle of those investigations. If we identify public health information that is useful for protecting the community, then we'll release that information. But what we're not going to get into is further damaging businesses and further creating stigma to either businesses or communities where a person may have passed by or have had some very minor contact, which does not qualify as a close contact, and thereby didn't put anybody at increased risk. So there's already enough fear out there. We don't want to exacerbate a problem by providing information that really doesn't have any public health value. Any other questions? Very good. Thank you very much, everyone. And as I mentioned, we will be providing these updates with some regularity. And again, I certainly encourage everyone to follow our social media presence and the county website as well.
Are you anticipating over the weekend?
Yeah, we will be updating those.
Are you anticipating another update this evening or not till tomorrow?
I do not anticipate another update tonight. But again, it's a highly fluid situation, and that's maybe the tagline for all of this. And we will provide updates as they develop. Okay. Thank you, everyone. Much appreciated.